So maybe let's branch into like how you view some of like PCOS and infertility when you have a new client come in. And just kind of, yeah, if you're cool with it, just use this for us to learn
Yeah.
and for the audience to kind of learn what kind of scope you're viewing things at
Mm-hmm.
and what type of care you want to be giving these people to obviously achieve their outcome, whether it is be able to have a child, be able to just like feel better and
Yeah.
function better in their day-to-day life.
Yeah.
Um, yeah, so PCOS is a tough
It
one,
is.
hard to diagnose,
Mm-hmm.
plus treatment in terms of
Yeah.
what you're going at. I guess, yeah, let's just explain what PCOS is
Yes.
medically and then kind of signs and symptoms, and we can just go from there
Sure.
if that's cool,
Yeah,
Lisa.
that sounds good. So yeah, PCOS stands for Polycystic Ovarian Syndrome, which back in the day, kind of the main diagnostic criteria that they would look for on a vaginal, pelvic ultrasound was if your ovaries had multiple cysts on them. And there's a string of pearls is how they describe the appearance. And that's, one of the possible diagnostic criteria for PCOS now. We follow, it's called the Rotterdam criteria. You have to meet 2 out of the 3 criteria. So polycystic ovaries on ultrasound is one of them. Hyperandrogenism, so high testosterone or higher levels of like the male type hormones, either on blood work or with clinical symptoms. So usually that'll be like increased facial hair on the chin. It's not just the peach fuzz, it's like the thick, coarse, dark facial hair, or struggling with really bad acne is another sign. Hair thinning from the top of the head, like male pattern baldness, can present also. So those are 2. And then the third one is like irregular menses. So going long periods of time without your period. A lot of people can go months and months and months and only have a couple periods a year if they have PCOS. So you have to meet 2 of those three criteria to be diagnosed with PCOS. That can be tricky sometimes, just depending, because I think for a lot of people, their symptoms can fluctuate, and it depends on like how stressed they are, what their diet and exercise, sleep has looked like in the past couple months for how they then present to you. So I need to get like a full scope picture of what's been going on, like when you first got your period, how long was it normal, if it ever was, when did it show up, when did it start to become abnormal? Can you think of anything else that, you were diagnosed with around the same time that all this started? Is your thyroid, functioning correctly? What's your blood sugar looking like? Do you have an elevated A1C? Are you pre-diabetic? There's like a whole, it's a very metabolic type syndrome, not just reproductive. And those 2 systems are very closely tied together.
Because it's play on insulin sensitivity as
Yes.
well.
Yeah. So if you have PCOS, you are more likely to have issues with insulin resistance, which is, going to affect your blood sugar, and it's going to affect how well your cells are bringing sugar into them to function properly. And if you have insulin resistance, that also then has a downstream effect on your hormones.
Right.
And you're usually producing more androgens, which then it's like a vicious cycle. It kind of feeds back in on itself.